place to ensure that this does not recur. Strategies to ensure coordination between the Ministry of Education and Ministry of Health. During this crisis period, Honorable Speaker and members, we have met together with my colleague, the Cabinet Secretary for Education, and we have put together a joint committee that includes the Commissioner of University Education, the Kenya Medical Practitioner and Dentist Council, COOPS, that is the one that admits students, the universities. And we have given them a timeline of 1 month to be able to look through what is it that is required in terms of production, in terms of the available facilities for training, and what we need to do to ensure that then we are training enough numbers that we are able to cater for. Honorable Speaker and honorable members, many years ago, it was only one university that was training medical officers, medical doctors in this country. As we speak now, we have 8 universities, 5 of them public and 3 private. All these, Honorable Speaker and honorable members, we have put them in the joint committee so that then we can find a solution that all the interns who come out of these universities, then we are able to absorb them for internship. From Honorable Nyikal, Honorable Speaker and honorable members, Honorable Nyikal is a member of the Health Committee, and on many occasions, I do refer to him on these matters. The issues that he has raised regarding the cadres that need internship. As a ministry, we have a total of 32 cadres, different cadres, all of them seeking recognition, all of them seeking to be paid for internship. But however, from this, only the medical officers, the pharmacists, the dentists, the degree nursing, degree clinical officer, and diploma clinical officers are the ones so far who enjoy stipends. So as the ministry works on the policy that we are working on, we will largely benefit from the wisdom of Honorable Nyikal on what we need to do in terms of recognizing the other cadres and also enhancing the cadres that are already getting the stipend. Medical insurance by national government recognizes all workers, all medical officers who work for national government. Honorable Speaker and honorable members, as we stand here, we very well know that those medical doctors who work for the national government, they work either at the ministry headquarters or they work in one of the referral facilities, the 6 referral facilities that we have. And those are the ones that I am confidently saying that the national government, through the Ministry of Health, has provided them with medical insurance. Honorable Speaker and honorable members, I am not in a position to confirm whether counties have indeed given medical insurance to their medical officers. That can only be confirmed by themselves, but from this crisis that has been going, a number of them, 36 of them, have confirmed to have medical insurance, and those who do not have, they have been asked to ensure that they have medical insurance. Regarding the registrars, we are working on a policy, Honorable Speaker and members, a policy to ensure that there's direction from Ministry of Health, because even as we train registrars, we must train those skills that are required for the national, those skills that are required by the country. We do not want to train excess of one skill and leave out another. So that policy is under development. Payment of interns. Honorable Speaker and honorable members, we were directed and guided by SRC, which is the body that is constituted by the Constitution to be able to guide. And from the guideline, they said it cannot be a remuneration, it can only be a stipend. And that is how we have recognized it. Honorable Speaker and honorable members, from the question from Honorable Mishimboko, what is the gross salary of an intern and what is the net thereof and what has been offered? Initially, an intern was earning 206,000. This includes basic salary and other allowances. That comes to a net of 135,000. Honorable Speaker and honorable members, based on the advice from the SRC, it is now a stipend of 70,000 shillings. And Honorable Speaker and members, I would like to clarify that none of the interns who is in session has gotten a reduction. Of the interns in session, that will be finishing or concluding their internship in June 2024, there is no reduction. It is the new interns who we are now posting that are going to get in under the terms of the stipend. From Honorable Junet, the issue of whole of nation approach. This was ordered by the Honorable Judge of the Employment and Labor Relations Court. That order is what brought us together. And the judge did guide on the membership of the whole of nation approach. And in respect and in compliance with the court order, that group under the whole of nation approach has been meeting to find solutions to this crisis, headed by Head of Public Service. Honorable Speaker and members, Honorable Junet wanted to know how 70 was arrived at. This was a guideline by the SRC. They would be the best then to explain how 70,000 was arrived at as a stipend. But need to say that they did look at the other interns within the nation, and actually they did inform us that the other interns are getting 25,000, and therefore they considered this higher and gave them 70,000. From Honorable Zamzam on Linda Mama, Honorable Speaker and Honorable members, I would like to request, because there is a specific question on Linda Mama, I would like to request that I respond to it, because it's a substantive question that I'll be responding to later. Honorable Speaker, from Honorable Mwenje, he asked about expectant mothers and where do they go at this time of a crisis. Honorable Speaker and Honorable members, I would like to appreciate Honorable Mwenje that despite him being a man, he is caring for the women. And for me as a woman, this is personal to me. As we speak now, Honorable Speaker and Honorable members, we have levels of service in the Ministry of Health. We have level 2, which are dispensaries. Closest to the people within the villages, services are ongoing. We have level 3, which are health centers, Honorable Speaker and Honorable members. Services are ongoing in those places. Where we are affected most by this crisis is level 4, level 5, and level 6, which are referral hospitals. But we have put measures in place to ensure that emergency services are being attended to. Last week when I did a tour of Kenyatta National Hospital, the maternity was full. Actually, all the expectant women around Nairobi are now in Kenyatta National Hospital being attended there. So we really have to see that the ministry has put in some effort. And I also want to thank Honorable Speaker and Honorable members that despite this crisis, we have very patriotic doctors who are working. We have been able to fill some of the gaps with those doctors who have been able to continue providing services, and I want to thank them tremendously for continuing to provide services to Kenyans. What have we done on rationalization? Honorable Speaker and Honorable members, after the SRC guidelines.
Junet, what's the point of order?
Mr. Speaker, I don't know whether you listened keenly to the Honorable Minister. The Honorable Minister, Mr. Speaker, has put up a very rosy picture that hospitals are working, Kenyatta Hospital is full, doctors are working, level 4, level 2, level 2. Mr. Speaker, that is not the situation on the ground, Madam Minister. People, there are no hospitals that are working. There are no wards that are full, Madam Minister. We are the people who are from the ground. Just say you are working on how to rectify the matter, but as of now, even the maternity that is full in Kenyatta Hospital, mothers are delivering on their own, or maybe with the help of few nurses.
Go on, Minister.
Thank you very much, Honorable Speaker and Honorable members. Level 2 dispensaries are manned by nurses. We have over 9,000 dispensaries in the country, and they are functional. Level 3 facilities are manned by nurses and clinical officers, and most of them are functional. I did acknowledge that indeed we have a problem at level 4, level 5, and level 6. But I say emergency services are being offered. And I just gave an experience of my walkthrough of Kenyatta National Hospital last week. Honorable Speaker and Honorable members, on what the ministry has done in rationalizing, after we received the guidelines from the SRC, we, the ministry, met with the National Treasury on 2 occasions. And that is how we got to get 2.3 billion to be able to post the current interns. We have also been getting the numbers that are in the pipeline in the training institutions, so that then we plan ahead through the budgeting process to ensure that then they are taken care of. The other question, Honorable Speaker and members, is what is the ministry doing to ensure that this does not recur? And I would like to reiterate, Mr. Honorable Speaker, that through the medium-term, long-term position that I had raised earlier, we believe that the ministry will be able to resolve this, and this does not recur. However, Honorable Speaker and Honorable members, I would like to thank members of this House that the ministry brought to this House 4 acts, and they were able to be processed. One of the outcomes of those 4 acts is the Social Health Insurance Act. The Social Health Insurance Act, Honorable Speaker and Honorable members, as we sit here today, less than 20% of Kenyans have some form of medical insurance. So what we intend to achieve with the Social Health Insurance Act is to drive those numbers up and ensure as many as possible. Our target is to get at least 80% of Kenyans to be on insurance. And once resources are raised through the Social Health Insurance Act, we want to believe that we'll be able to take care of commodities, take care of equipment, and take care of the most important pillar of universal health coverage, which is the human resource for health. Honorable Speaker, the question from Honorable Kajwang about the CBA. Honorable Speaker and honorable members, we cannot live in denial. We have 2 levels of government, the national government and the county governments. A collective bargaining agreement is a document signed between an employer and an employee. The ones that I spoke about, the CBA progress that has been made by the national government, is for those employees who are for national government. And therefore, I can authoritatively say that as the national government, we have managed to implement some of the things asked for in the CBA. Therefore, the relationship between the employer, who is county government, and the doctors then should be managed as such between the county governments and the employees. The issue of return to work formula. Honorable Speaker and honorable members, this matter went to the court, and the honorable judge ordered that the doctors should suspend their strike and give negotiation a chance. And they did order that then discussions should continue under the whole of nation approach to this matter. And I want to believe once discussions are finalized, the doctors have suspended the strike, then a return to work formula will be arrived at. Thank you, Honorable Speaker and members.
Kibagendi. Honorable Nyikal, you're out of order. I've not given you an opportunity.
Thank you.
I will come to you.
Thank you, Honorable Speaker.
I hardly give members to have a second bite, especially when you're a joyrider. Yes, Kibagendi?
Thank you, Honorable Speaker. And my question to Honorable CS is, why is NHIF not paying hospitals, both private and public hospitals, to the extent that our citizens are not able to get services? And in particular, there is discrimination to the region that I come from, Kisii County. Thank you.
Elisha?
Mr. Speaker, I just listened to the CS on our last statement, and I've just read in online that the AG has given an advisory that the teams will meet again so that this issue that is affecting doctors and the ministry can be solved expeditiously. So I think that's a good step on the right direction from the AG. I just wanted to give that information. Thank you.
Pasaris?
Thank you, Mr. Speaker.
You have your own question?
Yes, I do.
Oh, then if you are not on this, I saw your name here, then hold, I'll come back to you. Dr. Nyikal, I'll go out of my way to give you a second bite.
Chair, there was a question of coordination.
And there's no chair here, it's only the speaker.
Sorry. Mr. Speaker,
Yes.
It's a question of coordination. The honorable, the minister is right that they have paid at the national level and the county government have not paid. But my concern is the ministry holds policy, and this policy is actually supposed to be implemented across, so that there should be uniformity on what is happening. And if it's not there, still there should be information at the level. And I was asking, are we using the constitutional bodies such as the Intergovernmental Relations Technical Committee, particularly the Health Forum, where the technical people at the ministry and at the county will meet? And so things will be done similarly at the national level and the county level. That is my question. Is it being used? Is it useful?
Thank you. Nisula.
Mr. Speaker, I wanted to direct my question to the Cabinet Secretary. I am aware that the National Insurance Fund, the National Health Insurance Fund, NHIF, ended the Edu Afia, where our learners were being covered, and I just wanted to find out what is the alternative, or whether the shift is going to cover our learners in schools.
Thank you. Who is the member there? Is that Edith Nyenze? Yes, Edith?
Thank you, Speaker. I wanted to find out from the CS, how do you compare the rate of death from the time the doctors went on strike as compared to the last time last year? And as your ministry, is your ministry doing enough to ensure that the doctors go back to work?
Okay. Yes, Women Rep for Narok, Rebecca Tonkei. Yes, there you are.
Yeah, thank you, Mr. Speaker, sir. I want to ask the CS, Honorable Speaker, the CS has spoken about the internship policy which they are developing. And Mr. Speaker, sir, I've had an opportunity to skim through that policy. And what I realized, the CS proposal will further discriminate the interns. Because when you look at one of the proposals, is that CS, you've said that there are those who will not qualify for the stipend. And among them are people who are self-sponsored. So it means if a student is sponsored by the parents or corporate bodies, then that student will not qualify for that stipend. Honorable Speaker, can the CS tell us what is the reason? Because this is going to further discriminate the students who are self-sponsored. Secondly, Mr.
Only one, Rebecca.
Okay, thank you.
Only one. Elachi will be the last on this, then we go to other questions.
Thank you, Mr. Speaker. And while I appreciate Waziri for very elaborating us to understand and also making us understand the figures. You know, when you get the figures, Mr. Speaker, is when you realize the interns are quite a good number. And we just have to think, even in this house, how to add some budgets. But having said that, Mr. Speaker, my question is, the missionary doctors are being asked to pay Kenya shillings 500 per year for their work permit. And I would wish Waziri to look at it, because right now when the doctors were in strike, I believe the missionary doctors who come in as volunteers are the ones who have been working, and most of them come for churches and all that. So if she can look at it, I know she might not be able to answer completely here, but it is something we need to look at it as a country. I don't know whether it is right to charge 500,000 to that.
Minister.
Thank you, Honorable Speaker and Honorable Members. The question raised by Honorable Kibagendi regarding payment of NHIF claims. Indeed, there has been a delay in payment of claims due to delay in exchequer release. Honorable Speaker and honorable members, as we speak now, NHIF owes service providers close to 30 billion shillings. And of these 30 billion shillings, 22 billion is owed to NHIF by government and other government entities. Honorable Speaker and honorable members, this week, we have had a meeting with National Treasury, and yesterday, the Principal Secretary for Medical Services did receive a confirmation from Treasury of a release of 5.5 billion for payment of claims. So we are expecting that once the money hits the account this week, then payment of the claims by NHIF need to proceed as from next week. But also want to clarify that payment of claims is an ongoing exercise. Last year alone, NHIF paid out a total of 36 billion shillings. So as claims continue to be verified and reconciled, they get to be paid as and when exchequer releases are available. The issue by Dr. Nyikal about the CBA, really a CBA is collective bargaining agreement between an employer and an employee. Medical cover is provided by the employer to an employee. So I still want to say, Honorable Speaker and members, that as national government, we can only take responsibilities for the employees that belong to the national government. And having said that, the issue of a CBA is not a policy issue. The issue of a CBA is what is signed and agreed between parties. But the ministry, we continue to play our responsibility in development of policies, and that is why at the moment we are working on the internship policy. Regarding Edu Afia, Honorable Speaker and honorable members, this scheme came to an end, lapsed in December. Before lapsing, the Ministry of Health wrote to the Ministry of Education, informing them of the end of the scheme of Edu Afia. We expected that then the Ministry of Education would write back and ask the Ministry of Health to extend that, but that was not done. So we did not receive an extension. However, Honorable Speaker and honorable members, I would like to confirm that under the new Social Health Authority, we now have a cover for all Kenyans. And this has expanded benefits package. That besides Edu Afia that was covering a student, the Social Health Authority Act now ensures that there is a cover for all members of the family. That includes mama, it includes the children who are in school, it includes the mzee who may not be at school. So we now have an expanded benefits package to cover all members of the family. Honorable Speaker and honorable members, the issue of the rate of death in the facilities occasioned by this crisis. Honorable Speaker and honorable members, the ministry has a tool on a daily basis that we get to receive what is happening in our health facilities. And from the national level, Honorable Speaker and honorable members, the rate of death has gone down. But as a ministry, we know it is because people have not been coming to hospital. So we want to go further and drill and see what is happening within the communities. And once we get to that point, then we shall conclusively say what is the rate of death based on the crisis. The question raised by Honorable Tongei regarding the policy that there is a discrimination. I would like to affirm that the policy is still under development. We have only done internal stakeholder validation. We have an opportunity for external stakeholder validation. And during such a process, comments, reviews, and suggestions are received from several stakeholders. And I want to believe that if that came through from their stakeholders, then it will be subjected to the process. And the document that we will end up with as the policy will be one that speaks to the needs of majority of Kenyans. On the issue of missionary doctors, the permits, Honorable Speaker and honorable members, are issued by Ministry of Interior. I would not want to comment on it. For us, we wait until they have been issued permits. Then the Kenya Medical Practitioner and Dentists Council issues licenses for their practice. But that is an issue that has been raised by the faith-based organizations, and it has already been given to the attention of the Ministry of Interior to be able to look at it and see how do they rationalize. And I want to agree with the honorable member that indeed the missionary hospitals, the faith-based facilities are playing a critical role during this crisis. Thank you, Honorable Speaker and members.
Thank you, Minister. We'll end there on this question. We'll now go to the next questions. Honorable members, the next ones, I'll allow the questioner and one joyrider so that we can make progress. Member for Ruiru, Simon Kingara, question 020 of 2024.
Thank you, Honorable Speaker. May I take this opportunity to thank you for granting me an opportunity to ask a question number 20 of 2024, directed to the Cabinet Secretary for Health. Could the Cabinet Secretary clarify whether the Kenyatta University Technical could the Cabinet Secretary clarify whether the Kenyatta University Teaching, Referral and Research Hospital imposes high deposit before attending to patients and that the NHIF cover caters for very minimal amount as compared to other facilities such as Kenyatta National Hospital and Kiambu Level 5. Number two, Mr. Speaker, sir, could the Cabinet Secretary provide details on the budgetary allocation provided to the hospital in the financial year 2023-2024, and further confirm that the Credit Control Department holds numerous title deeds for patients who are unable to meet the high medical bills and considerable number of bodies are locked at the hospital mortuary. Finally, Mr. Speaker, could the Cabinet Secretary elaborate on measures by the Ministry to ensure affordability, including offering the waivers of health care services within the facility, especially given the diverse income levels of the population of rural and neighboring constituencies that the facility serves? Thank you, Mr. Speaker.
Thank you, Honorable Speaker and Honorable members. We need to clarify whether Kenyatta University Teaching and Referral Hospital imposes high deposits before attending to patients, and that the NHIF cover caters for very minimal amounts as compared to other facilities such as Kenyatta National and Kiambu Level 5 Hospital. Honorable Speaker and Honorable members, Kenyatta University Teaching Referral Hospital does not impose high deposits before attending to patients. The hospital attends to all patients who come through either referral, through the specialized clinics, or through the outpatient department or the accident and emergency department. These patients who come to this hospital, they are in most cases seeking highly specialized care since it is a referral hospital. At the accident and emergency department, patients are normally stabilized even before they are asked to pay the consultancy fee. At the outpatient department and the specialized clinics, patients pay a minimal consultancy fee as prescribed by the consultants. Deposits are only asked for where the consultant determines that the patient needs admission for continuation of care as explained hereafter. The hospital admits patients through the referral, specialized clinic, or an emergency basis. The hospital admission policy and procedures and the hospital referral policy are both informed and aligned to Article 43, Part 2 of the Constitution, which states that no person shall be denied emergency medical treatment. The admission policy and procedure section states that the hospital will ensure that no patient shall be denied admission due to race, color, religion, ancestry, financial class, nationality, or any other form of discrimination. In the same policy, in cases of emergency, there will be no financial obligation. The referral policy states that all emergency referrals to be accepted without fail and unnecessary delay or shunting of patients should be avoided. They will be given priority on arrival. Honorable Speaker and honorable members, on waived hospital bills, the hospital does not deny care to any patient who requires emergency care or admission on the basis of cost of care. Majority of these patients get admitted without the deposit, but with a promise to pay upon discharge. However, some do not honor their promise because they are genuinely unable to cater for their treatment costs fully. Others are only able to pay partially for the services rendered. As a result, the hospital has unpaid bills of 403 million since the hospital began 4 years ago. And this now has been requested in the budget for reimbursement. Regarding the NHIF cover, the hospital has a hybrid model that has both comprehensive and non-comprehensive covers. Patients admitted under the comprehensive cover do not top up for the cost of their care, including all required pharmaceuticals, diagnostic services, surgery, and medication. For example, for all patients under the national NHIF scheme, access surgery purely under the comprehensive cover. Under NHIF non-comprehensive cover, patients co-pay as outlined in the contract for different services. This arrangement is actually the same with that of Kenyatta National Hospitals. Patients at Kenyatta University Teaching and Referral Hospital have access to a whole continuum of care with a rare need to access services like imaging, special lab works, specialized consultancy outside the hospital. This is unlike the lower level hospitals where patients have to buy some items or seek services outside the facility, which translates to huge out-of-pocket costs despite the NHIF cover. On part 2 of the question, that we provide details on the budgetary allocation provided to the hospital in the financial year 2023-2024, and further confirm that the Credit Control Department holds numerous titles for title deeds for patients who are unable to meet the high medical bills, and considerable number of bodies are locked at the hospital mortuary. Honorable Speaker and honorable members, the hospital budgetary allocation for financial year 2023-2024 was 5.8 billion shillings, consisting of the GOK grant of 2.986 billion and the A&A of 2.9 billion. The development budget for the hospital is 350 million. The actual expenditure for PE is 3.988 billion against the GOK allocation of 2.986 billion. Hence, there is already a gap of 1 billion, which the hospital struggles to meet, despite it not having the required staff establishment for optimal service delivery. In the next financial year, 2024-2025, the hospital requires a PE allocation of 4.072 billion from the government. In the Department of Credit Control, the hospital's Credit Control Office plays a crucial role in assisting families facing financial difficulties by offering credit payment plans. This initiative benefits both the patients and the hospital in several ways. The benefit to the patient is that elimination of unnecessary hospital stay. Patients can leave the hospital once arrangement for payment has been made, and this reduces their stay. Prevention of accumulating unmanageable bills. By entering into credit payment plans, patients can manage their medical expenses over time rather than facing a large immediate financial pain. Reduced risk of hospital-acquired infections. Due to the shorter hospital stay, they decrease the likelihood of patients contracting infections during the time in their hospital. The benefit of these payment plans to the hospital is that there is availability of hospital space. Releasing patients who have settled their payment arrangement it frees up space, allowing the hospital to accommodate other patients. Efficient resource allocation. By recovering debts through credit payment plans, the hospital can allocate its resources more effectively, ensuring that resources are available for patients who need them. There is also mitigation of budgetary limitations, thus managing outstanding debts, and helps the hospital to navigate the budgetary constraints that it experiences. The use of title deeds as security for these arrangements. Title deeds are utilized solely as security for the commitments made by the patients or their families. Once the debt are fully recovered according to the agreed upon terms, the title deeds are returned to their respective owners. This practice provides assurance to the hospital that the debts will be repaid, while also safeguards the assets of the patients or their families. Overall, this approach demonstrates a proactive effort by the hospital to address financial challenges faced by patients and their families, while also ensuring efficient operation of healthcare services within the constraints of budgetary limitation. The issue of dead bodies being locked at the hospital mortuary The hospital preserves dead bodies for relatives as they make funeral arrangements. Some bodies stay longer in the morgue for long due to various factors. Some have cases arising from court and there are disputes, therefore the bodies stay longer until the dispute is resolved. The hospital also has unclaimed bodies. We have delays from families as they fundraise and make funeral arrangements. Some families make requests to be allowed time to enable them to fundraise, since once a burial is done, it becomes difficult for them to mobilize funds. Where a family has requested for a waiver of a hospital bill, they wait for the outcome of the waiver process. The process involves socioeconomic analysis, and at times, it involves a home visit to enable an objective determination of the request. Part 3 of the question, to elaborate on measures by the ministry to ensure affordability, offering of waivers for healthcare services within the facility, especially given to the diverse income levels of the population in Ruiru and neighboring constituencies that the facility serves. Honorable Speaker and honorable members, the Ministry of Health is currently on course in the establishment of the Social Health Authority and the seamless transition from NHIF. The Social Health Authority will provide social health insurance up to 85% of the population in the formal and informal sector. The government will continue paying for the indigents and the vulnerable populations. These measures will ensure that most Kenyans, including the poor and the vulnerable households, will have a form of prepayment of health insurance anytime they visit a facility, and they will not have to pay from out of pocket. The Social Health Authority, together with the Ministry of Health, has developed a comprehensive health benefits package enough to cover at least 70% of the prevalent conditions. The citizens of Ruiru and Kenyans at large will have to register and contribute to the social health insurance, the ability to pay in order to access services, not just at Kenyatta University Teaching and Referral Hospitals, but within other facilities. The Ministry of Health has also come up with a clear communication strategy on universal health coverage that will sensitize citizens on the need to enroll in social health insurance and therefore be able to benefit on the expected benefits from the Social Health Authority. Honorable Speaker and honorable members, I hereby submit. Thank you.
Member for Ruiru, you're satisfied? Give him the mic. There you are.
Thank you, Mr. Speaker, sir. The questions are necessitated by discomfort of the community, and as it was answered to us, there are some areas which maybe I need some clarification, if you allow. Mr. Speaker.
Just seek one clarification.
Yeah, actually it's one clarification.
Yes.
Mr. Speaker, at the last bit of the answering, the minister said that the bodies or the documents are held because of arrangement by families or the same. But Mr. Speaker, there are documents held by that facility, and I have evidence for more than 2 years. So my question is, how long can the facility hold the documents for the concerned family or the deceased person? And secondly, maybe how long also can they hold the body, because we also know bodies which have been there for many, many months or years. Thank you.
Waziri? Sorry. Magali Mulu? Yeah,
Thank you, Honorable Speaker. Honorable Speaker, it looks like I misplaced my card, so I want to thank you for giving me the chance. Honorable Speaker, I want to ask a question which is related to the issue. Although this question is specific to Kenyatta University Referral Hospital, I think the bigger issue, Honorable Speaker, is the issue of the cost of treatment in this country, both medication, consultation, and all things to do with surgery. And Honorable Speaker,
Makali Mulu, I've given you an opportunity to ask a supplementary to the specific question.
Yeah, my specific question, Honorable Speaker, now that we have the CS here, is there anything the ministry is doing, Honorable Speaker, to bring down the cost of medication in this country and treatment? Because I think that's a bigger question, Honorable Speaker, in this country.
Okay. Minister. answer the two. Esther, you have two questions, so just hold your horses. You can combine whatever you want to ask within your questions.
Thank you, Honorable Speaker and honorable members. On the issue of how long the bodies should be kept and should the documents be kept. Honorable Speaker, as I submitted earlier, before this is done, there is normally a conversation between the family and the hospital, and they agree on a plan. So once the plan is finalized, then the bodies are released or the documents are released to the family. But we shall retreat as a ministry to check into the ones you have said that they have stayed for very long. We are happy to get the specifics so that then we can address it with the hospital. Honorable Speaker, on the cost of treatment, the ministry has shifted focus from focusing on curative nature to now primary health care. Primary health care, Honorable Speaker and honorable members, is to ensure that we focus on prevention of disease. In itself is a way of ensuring that we manage the cost of health care. But furthermore, in terms of the commodities and other health products and technologies, the ministry has reinvented and is working specifically to focus on local manufacturers to ensure that other costs that are lumped on products and technologies, being that they have been brought into the countries, are reduced. And so far, the Kenya Medical Supplies Agency Authority has been able to implement the local manufacturing policy, and close to 50% of the items are now being sourced locally. Chair and honorable members, I submit.
Joshua Kandia.
Thank you, Honorable Speaker. I rise to ask question number 021 of 2024, and this is directed to the Cabinet Secretary for Health. 1. Could the Cabinet Secretary provide a list of all community health promoters in all the 290 constituencies? 2. Could the Cabinet Secretary explain the methods used by the ministry to select the said community health promoters across the country? 3. Could the Cabinet Secretary explain why drivers are not considered and counted as prone to risk while handling the emergency cases in Kenya? Thank you, Honorable Speaker.
Minister.
Thank you, Honorable Speaker and honorable members. The question is for the Minister of Health to provide a list of all community health promoters in the 290 constituencies. Honorable Speaker and honorable members, I would like first to begin by saying community health services aim at empowering individuals, families, and communities to take charge of their health. Community health services are delivered by the community health promoters at the household level. And some of the services that they provide is health education and promotion, disease prevention and control, and this is to reduce morbidity, disability, and mortality, family health services, environmental health, provide first aid, psychosocial support, and managing the general health data. Honorable Speaker and honorable members, community health promoters are assigned approximately 100 households which they visit on a routine basis. Each community health unit has 10 community health promoters. There is a community health committee that oversees the affairs of a community health unit. Each community health unit comprises of 5 to 7 members drawn from among the community members. We have a table, Honorable Speaker and honorable members, that has enumerated the community health promoters per county, but we have these names per constituency. Across the nation, we have 107,000 community health promoters. If we were to print, that would be very bulky, but we are able to offer the soft copy specifically for Baringo County, Baringo constituency, and any other constituency that may want to see the list of the community health promoters. On the second question...
For the curiosity of the member, I don't know what he wants to know, but he just sent the soft copy of all the 290 constituencies. He will go through If he has any issues, he can file a question through the committee.
Thank you, Honorable
Go to the
Speaker.
second question.
On the second question, explain the method used by the ministry to select the said community health promoters across the country. Honorable Speaker and honorable members, the selection of community health promoter is guided by Section 9 of the Primary Healthcare Act 2023, which defines the criteria for community health promoter as follows. A community health promoter shall be selected by the community through a public participation forum, and they shall be appointed by the county government. A person qualifies for selection and appointment as a community health promoter under subsection 1 if the person is a citizen of Kenya, is above the age of 18 and is of sound mind, is responsible and respected member of the community, understands the role of community health promoter, is a resident of the respective community for a continuous period of not less than 5 years prior to the appointment date, is literate and can read and write in at least one of the national languages and the local language, is not disqualified for appointment office by any other criteria of law. A community health promoter shall be appointed on such terms and conditions as the respective county public service board shall determine. Each county executive committee member shall prescribe in the county legislation regulations approved by the respective county assembly for the conduct of public participation forum. Section 10 further provides for a framework for the conduct of the public participation during the selection of CHPs. Conduct of public participation. In conducting the public participation forum under Section 9, the county executive committee member shall publish and publicize through the mechanisms established by a county government under Section 95 of the County Governments Act a notice of the proposed selection process at least 7 days before the conduct of the process. They are expected to avail to the residents of the county information regarding the agenda with respect to the selection process, criteria for selection of community health promoter, the process of submitting the nomination for selection, and such other information as the committee member may consider necessary for the effective participation and conduct of the selection process. The public participation shall provide, where necessary, interpretation of services for persons who are not conversant with the national language, where the national language is the principal language of communication during the conduct of the public participation forum. They shall keep and maintain an attendance register for all persons attending the forum. The conduct of public participation forum shall be guided by the principles of citizen participation in counties under Section 87 of the County Governments Act, provision of effective mechanisms for involvement in the public, including special interest groups who will be affected or be interested in the decision. Participants' equitable access to the information they need to participate in a meaningful manner. Establish of an appropriate feedback mechanism, adherence to the national values under Article 10 of the Constitution, adherence to the principles of public participation as may be prescribed by the written law, and ensuring that the needs and interests of all persons are catered for. The transition of existing community health volunteers, health workers to community health promoters. Despite Section 9, a person appointed as a community health volunteer or community health worker at the commencement of the Act shall be deemed to be appointed as a community health promoter under the Act. The third question is to explain why drivers are not considered and accounted as prone to risk while handling emergency cases. Honorable Speaker and honorable members, delivery of universal health coverage, including quality emergency care to all Kenyans, is a priority for the government of Kenya and the Ministry of Health. Emergency vehicle operators or ambulance drivers play a key role in the delivery of quality emergency care. The Ministry of Health recognizes them and that they are exposed to diverse risks as they perform their duties. The Ministry of Health is committed to ensuring the safety and well-being of all healthcare personnel working in Kenya. The Constitution of Kenya 2010 states that every Kenyan has the right to the highest attainable standard of health, which includes the right to healthcare services. The Health Act 2017 states that every person has the right to emergency medical treatment, including pre-hospital care. The Social Health Insurance Act of 2023 establishes the Emergency, Chronic and Critical Illness Fund to cover the cost of emergency treatment. The Ministry of Health has developed the Kenya Emergency Care Policy 2020-2030 and Kenya Emergency Care Strategy 2020-2025 to accelerate the development of an effective emergency medical care system for Kenya. The policy and strategy are based on World Health Organization Emergency Care System Framework, which highlights 3 areas where emergency care is provided: at the scene of illness or injury, by bystanders, deliver first aid and call for help from the ambulance service. Further care may be delivered by emergency care personnel when they arrive at the scene. During transport in an ambulance, the patient is monitored, information regarding the patient is communicated to the receiving health facility, and delivery of medical intervention continues. At the health facility, the patient is received by emergency department staff for ongoing care. The Kenya Emergency Care Policy 2020-2030 recognizes the key role played by emergency care personnel, including the drivers. It highlights the shortage of these key personnel in Kenya. The Kenya Emergency Care Strategy outlines the key intervention to increase the numbers of drivers to ensure that they have the knowledge, skills required to deliver quality service to Kenyans while minimizing the risk to themselves, to the patients, and to other personnel and other road users. And the key interventions are development of a standardized curriculum for training of these drivers, establishment of a standardized framework for regulation, licensing, and continuous professional development of emergency ambulance drivers, institution of norms and standards for staffing all levels of emergency care. The ministry intends to roll out a holistic program to enhance capacity to motorcycle riders, institution drivers, matatu and lorry drivers on basic first aid and triage, which we have called Afya Barabarani. Training and equipping community health promoters on first aid and joint emergency interoperability principles, that is linking services together. The ministry plans to establish a command and control center linked to ambulance dispatch centers, fire department, police, and all emergency support function. A toll-free number to be provided to all sectors for emergency calls, immediate triage, sorting, and timely response. In 2019, the Kenya Bureau of Standards, in collaboration with the Ministry of Health, developed a minimum ground ambulance requirements. Compliance with these detailed requirements promotes safety for the ambulance drivers and all passengers traveling in an ambulance. In conclusion, the Ministry of Health is committed to delivering quality health services to all Kenyans. This includes the safety and well-being of healthcare personnel, including the ambulance drivers. While a lot remains to be done, and the ministry is committed to delivery of quality training, registration, licensing, and continuous professional development is ongoing for the existing numbers. Honorable Speaker and honorable members, I submit. Thank you.
Thank you. Kandia, are you satisfied? Give the mic to Honorable Kandia.
Thank you, Honorable Speaker. I am partly satisfied. However, the last question, the CS has not given us whether they are going to be considered as, they are going to be given a risky allowance, drivers, because they are doing the same work the other emergency workers are doing. That is that was my question.
Drivers in the ministry or drivers anywhere?
Emergency drivers.
Emergency drivers.
Yeah.
Okay.
And secondly, Mr. Speaker, I have a second question which the minister can answer. Can the cabinet secretary tell Kenyans whether county government is paying these community health promoters, or they are relying on national government only?
Minister, take a minute to answer that. We now must move faster.
Thank you, Honorable Speaker and members. On the issue of risk allowance to drivers, I think that needs to be determined by the Salary and Remuneration Commission, and as a ministry, we will write to get their guidance. On the issue of payment to community health promoters, the national government and the county government have signed an intergovernment participating agreement whereby 50% of the stipend is paid by the national government and 50% of the stipend is paid by the county governments. I want to confirm that the national government is paying the stipends to the community health promoters. Thank you, Honorable Speaker.
Duncan Madenge. Minister, now we must take a maximum of 5 minutes per question.
Thank you, Honorable Speaker. I wish to ask question number 086 of 2024 to the Cabinet Secretary. Could the Cabinet Secretary explain the factors used to determine how much a non-salaried Kenyan citizen ought to pay to SHIF and how regularly they should pay per year? Second question, the second part of the question, could the Cabinet Secretary state the percentage of the salary that employed Kenyans should be deducted from the payslip towards the SHIF, and further clarify if there is an upper limit on the contributions? Thank you, Honorable Speaker.
Minister.
Thank you very much, Honorable Speaker and honorable members. The question is for us to explain the factors used to determine how much an unsalaried Kenyan citizen ought to pay to Social Health Insurance Fund and how regularly they should pay per year. Honorable Speaker and honorable members, I want to begin by appreciating Honorable Duncan Madenge as a member of the Health Committee. We have been with him in discussions. He has been participating actively in the development of regulations, and he even hosted the Ministry of Health during the public participation of regulations in Nyeri. Section 27 of the Social Health Insurance Act 2023 provides that in case of a household whose income is not derived from salaried employment, an annual contribution of a proportion of household income is determined by the means testing instrument. In the Social Health Insurance General Regulations 2024, this was further explained by Regulation 18, Part 1 to 2, which states that a household whose income is not derived from salaried employment shall pay an annual contribution to the Social Health Insurance Fund at a rate of 2.75% of household income as determined by the means testing instrument as per Regulation 21. The factors to be considered by the means testing tool are individual and household characteristics. Individual characteristics include the number of family members, marital status, and the gender of the household head, whereas household characteristics include housing condition, access to services, e.g. electricity and source of water. This means the means testing tool will then run the data and provide the estimated income of a household using consumption data from the Kenya National Bureau of Statistics. The non-salaried persons will be required to pay annual contribution to curb the use of adverse selection where only the sick pay for insurance. Under question 2, to state the percentage of the salary that employed Kenyans should be deducted from the payslip towards Social Health Insurance Fund and clarify if there is an upper limit on the contribution. Honorable Speaker and honorable members, Section 27, Part 2A of the Social Health Insurance Act 2023 provides that in the case of a household whose income is derived from salaried employment, a monthly statutory deduction from the wages or salary by the employer at a rate prescribed by the Act, in tandem with the Act, the Social Health Insurance General Regulations of 2024, Clause 17, Part 1, states that for a household whose income is derived from salaried employment, a monthly statutory deduction to Social Health Insurance Fund at a rate of 2.75% of the gross salary or wage of the household shall be contributed by the 9th day of each month. There is no upper limit on the contribution. Honorable Speaker and honorable members, I submit. Thank you.
Speaker, I have a supplementary question.
Go ahead.
Honorable Speaker, going by the explanation given by the Minister, the means testing instrument is an algorithm that will be applied to an assessment done on households. An algorithm is blind to realities. AI is insensitive to real life. And I'll give an example of an elderly lady in Nyeri known as Mama Waziri, who is about 87 years old. She lives in a stone house that has corrugated iron sheets. She is supplied with piped water, and she has a TV. But Mama Waziri has been a widow for the last 27 years. At any one time that we distribute relief food in Roringo Muslim village, she is always #1 on the list. How will this algorithm capture the reality of Mama Waziri's life despite the appearance of her dwellings? The second one, Honorable Speaker, is this 2.75% deduction or payment from the income of households that are not in employment annually in advance, against the 2.75% deduction for people who have a payslip. Isn't this an unfair administrative action where you are charging the same percentage, but one set of residents in this country have to pay monthly deductions and another one has to pay annually? That is discrimination, in my view, which is explicitly prohibited in our Constitution.
Thank you, Sunguli. You'll be the only joyrider there. Give Julius Sunguli the mic. There you are.
Mr. Speaker, I want to appreciate the Cabinet Secretary for the determination, actually, and that she had put in setting up this new law. She has exhibited a lot of competence in this. As a member of the Health Committee, however, I want to ask the Cabinet Secretary maybe to clarify that there are no regulations as yet, and that tomorrow she is appearing before the Committee on Delegated Legislation to present those draft regulations for passing. And but in a more substantive way, that the minister, and this we have discussed in the Health Committee, can she now admit that actually what she is calling the means testing tool is a very, very complicated tool? Who will actually be carrying out the means testing? And isn't it true, Minister, that the results of this will be very subjective, and that what one person is paying will be very different from what another one will be paying? It's just like sitting on a plane, you don't know what the other customer has paid. Who will be testing? Who will be carrying out these means testing? It's a very, very complicated thing. Why don't we just come up with one flat rate for people to pay?
Minister, can you answer those short questions in a minute or two?
Thank you, Honorable Speaker and Honorable Members, and thank you, Honorable Madenge. I think we have had this discussion extensively during the development of the regulations. Means testing is a scientific tool that's developed by actuaries and health economists. But I want to confirm that we also have CHPs on the ground who know the real and true characteristic of each of the community members. So this will be put into consideration as well. But I also want to confirm that once a tool is developed, then it is subjected to piloting. That is when then issues that come out of that tool can be responded to. So the adjustments will be done as and we continue and as we implement. On the regulations, Honorable Sunkuli, we were with you when we met the Committee on Delegated Legislation, and we did submit the regulations. They have since been gazetted and submitted to this House for discussions. Thank you, Honorable Speaker and Honorable Members.
Ask both your questions. Minister, you'll take question 87 and 88 at the same time.
Thank you, Mr. Speaker. Mr. Speaker, I ask question number 87 of 2024. Could the Cabinet Secretary explain the measures taken by the government to equip hospitals to test and treat H. pylori? Part 2. Could the Cabinet Secretary provide statistics detailing the number of persons tested and treated for H. pylori in public hospitals? Question 88 of 2024. Could the Cabinet Secretary explain the measures taken by the government
to provide surgical operations and medications for patients suffering from fistula, but who cannot access medical cover? Part 2, could the Cabinet Secretary state whether the Social Health Insurance Fund, SHIF, would cover surgical procedures and treatments for patients suffering from fistula? Thank you, Mr. Speaker.
Thank you, Honorable Speaker and Honorable Members. We need to explain the measures taken by the government to equip hospitals to test and treat Helicobacter pylori, which is commonly known as H. pylori. Honorable Speaker and Honorable Members, currently in Kenya, H. pylori is tested using rapid antibody or antigen kits, which is not invasive as endoscopy with biopsy, and are also called point-of-care tests. Hospitals source for these kits independently or from Kenya Medical Supplies Authority for level 4 facilities and above. The ministry, however, is currently reviewing the specification of the test kits available with a view to including them in the laboratory essential diagnostic list. In level 4 to 6, biopsies are also done during endoscopy, which is an invasive procedure and requires specialized skill to perform it. The Kenya guidelines recommend that patients with H. pylori are treated using a combination of antibiotics and proton pump inhibitors. These medicines are listed in the Kenya Essential Medicine List of 2023 and are stocked by Kenya Medical Supplies Agency. The list guides counties and KEMSA in the procurement and distribution of medicines to various levels of care. According to the list, the proton pump inhibitors should be available in level 3 and level 4 facilities, while the antibiotics of choice are listed to be available in level 4. KEMSA also stocks the triple therapy kit, a kit comprising the 3 medicines for treatment of H. pylori, which is drawn by the counties for level 4 facilities and above. Part 2 provides statistics detailing the number of persons tested and treated for H. pylori in public hospitals. Honorable Speaker and honorable members, the statistics available are for the number tested for H. pylori and those tests that have turned positive. According to reported data from the Kenya Health Information System in facilities, that is faith-based, private and public facilities, in 2023, about 1 million tests were conducted with a test positivity rate of 26%, of which 500,000 were performed in the public hospitals with a positivity rate of 22%. There is no specific data on the number of patients treated for H. pylori, but as digitization of the health system continues, the data will be available in future. Honorable Speaker and honorable members, I submit on that question. On the second question, explain the measures taken by the government to provide surgical operations and medication for patients suffering from fistula but who cannot access medical cover. Honorable Speaker and honorable members, the government through the Ministry of Health and the Social Health Authority has developed a benefits package of entitlements that beneficiaries will be receiving. This benefits package has been gazetted under the 3rd schedule of the Social Health Insurance General Regulations of 2024. The package of health intervention is comprehensive and includes the management of fistula. Furthermore, it takes care of neglected women's diseases, which include pelvic inflammatory disease, breast lumps, pregnancy complications, myomas, amongst other conditions. The Social Health Authority will reimburse providers or hospitals who provide these services to our women and girls. Part 2 of the question states whether Social Health Insurance Fund will cover surgical procedure and treatment for patients suffering from fistula. Honorable Speaker and honorable members, the Social Health Insurance Fund will comprehensively cover surgical procedures and management of patients suffering from fistulas and will ensure the promotion and prevention of fistulas through the provision of quality health care. Honorable Speaker and honorable members, I invite members to look at the 3rd schedule of the Social Health Insurance General Regulations of 2024. The benefits package has been defined. Honorable Speaker and honorable members, I submit. Thank you.
Esther Passaris, you are satisfied?
Thank you, Mr. Speaker. Mr. Speaker, when it comes to through the Speaker, CS, I want you to understand that when you look at H. pylori, When a woman goes to a hospital or a facility and she's having severe motion and stomach cramps and pain, and she needs to conduct tests, if she doesn't have NHIF or if she has NHIF, she is going to be asked for some money to conduct that test. The fact that she won't have the money to conduct that test, she will go home with untreated H. pylori. Now, at the moment, I've just checked with the public, with the Mama Lucy Hospital, the drug is actually out of stock. But what I want to say is, if H. pylori is untreated, and the government doesn't take it seriously in terms of making sure that we do random testing of society and of the communities to see where it's prevalent and what treatments can be happen, like we treat any other ailment, what's going to happen? We're going to deal with a lot of ulcers and stomach cancers. There could be a correlation between the increase in cancers of the colon because of untreated H. pylori. So for me, I was trying to get a global picture on whether the Ministry of Health sees H. pylori and the resultant illnesses, if it's untreated, as an issue, and if we have any plans to go to the public and test. Because amongst my friends, about 2-3 months ago, almost 6 of us all had H. pylori at the same time. So I'm beginning to think that it's prevalent, and we need to make an assessment of what's going on in the grassroots. When it comes to NHIF and fistula, fistula for me is, even though it's not life-threatening, it actually reduces the dignity of the lives of the women who suffer from fistula. I know that Kenyatta National Hospital offers the fistula surgeries with NHIF. Majority of the women who suffer from fistula do not have NHIF, so they're actually out there suffering. And when it comes to making sure that everybody is covered by SHIF going forward, I want to make a suggestion, Mr. Speaker, a suggestion on innovative financing. Because right now, you have not been able to get every Kenyan to actually sign up for NHIF, even at 500 shillings per household per month. So when we're going to SHIF, even if you're going to lower it and say it's X amount, I really believe that I agree with Mr. Honorable Madenge that getting them to pay it lump sum in the beginning would not work. I would like to take you to innovative financing through transactional tax. Maybe it would be easier for us to consider that, because that was used to raise money for vaccines by putting a tax on business class tickets and economy tickets by certain countries that came up, and that's why we get vaccines at a low price. So if you actually put an innovative tax of X%.
You are making a speech. Ask your question.
Yeah, but I just wanted to know whether the ministry was looking at innovative tax as an option to getting the people that cannot afford to pay lump sum to actually join SHIF through a tax on either their power bills or their mobile calls, because that's the way to make them actually not feel the burden and actually to loop everyone in to actually have the medical cover. Thank you.
Thank you, Esther. Minister, you hear the passion of the Nairobi women rep. You agree with her?
Thank you, Honorable Speaker and Honorable members. Honorable Pasaris is my friend, and on many occasions she has come to bring me ideas of what we need to do at different levels. The issue of out of stock of the drug for H. pylori at Mama Lucy, I think we have the drug at KEMSA. So then that is a supply chain issue between how stocks of products move from KEMSA to other facilities. But that can be looked at, and I would defer then the question to the governor of Nairobi, so that then they are able to explain the discrepancy, why the gap that we have the drugs at KEMSA, but they are not available at Mama Lucy. On the issue of fistula, Honorable Speaker and Honorable members, one of the things that we need to do is to educate, because the most prevalent source of fistula is for young girls who get pregnant and their organs are not yet mature really to hold babies. That is how they end up then with fistula in most cases. So it's to empower girls, especially from the less privileged, so that then they can go to school, they can understand what are the repercussions of some of these things, and so that we get a sustainable solution to it. We also understand, Honorable Speaker and Honorable members, that there are many factors to cancer.
Hold, Minister. Yes, Esther, is there a problem?
Honorable Speaker, with due respect, during the time of the pandemic, we had over 300,000 girls that were defiled, all right, and became pregnant. So those girls actually, because abortion, safe abortion is not permitted, and we've not released the regulations and trained people on safe abortion, what happens is those girls are forced to actually have those children and end up with fistula. So we should actually not look at behavioral circumstances leading to fistula. A lot of the people that suffer from fistula today is from sexual gender-based violence, and young girls having fistula is because of rape and defilement. So we need to make sure that we provide fistula operations, or we provide safe abortions for the young girls who are 10, 11, 12 and cannot. And the only reason we cannot provide safe abortions right now is because we have not released the regulations of safe abortions, and yet abortion is permitted by law when the doctor sees that the patient should have safe abortion. So at the moment, I think it's wrong to assume that it is behavioral characteristics of a girl that leads to fistula. I know lots of women who have delivered and they have small passages and they still have fistula, and those who are probably in marriages. So the women that I'm dealing with right now that have fistula are married women, and it can come through surgical procedures gone wrong too, and inflammations through urinary UTIs.
You've made your point. Minister?
Honorable Speaker and honorable members, I do understand, being a woman, the passion of Honorable Esther Passaris on this issue. But I want to confirm that as the ministry, we are guided by the Constitution. And thankfully, we are speaking in the House that is responsible for making the laws. So as it stands, abortion in Kenya is not allowed unless it is determined that the life of the mother and the child are at risk, and that has to be determined by a medical practitioner. So when that is amended, then the ministry will be able to take action based on that. But I want to thank Honorable Passaris and invite her to my office so that we can have deeper conversations. Thank you, Honorable Speaker and members.
Last on this, Wamchomba. Member for Githunguri.
Thank you, Mr. Speaker. I rise to ask question number 1010 to the Cabinet Secretary for Health. Could the Cabinet Secretary clarify whether the National Health Insurance Fund, that is NHIF, has ceased remitting funds to private hospitals for provision of free maternity services? And if so, what steps are being taken to ensure continued access to these services by pregnant women, and particularly from low-income backgrounds? 2, explain the measures taken to ensure the continued operation and access to free maternity services under the Linda Mama initiative, particularly in the light of Social Health Insurance Fund, yet to be fully implemented. And 3, provide details on how the Social Health Insurance Fund will facilitate comprehensive access to reproductive health care for women. Thank you, Mr. Speaker.
Thank you, Minister.
Thank you, Honorable Speaker and honorable members. This is the question that ties up to the question that had been asked by Honorable Zamzam, and I wish to respond as follows. Honorable Speaker and honorable members, the free maternity services are financed by the Exchequer through National Hospital Insurance Fund on a fee-for-service arrangement. The fund has not ceased remitting funds to private hospitals for provision of these services, and mothers continue to get services from contracted facilities. Facilities, in turn, bill National Health Insurance Fund thereafter. However, there has been a delay in remittance of Exchequer from the National Treasury. The Ministry has engaged the National Treasury for release of 4.098 billion owed under the Linda Mama scheme. The Ministry has this week received a confirmation from Treasury on release of a total of 5.5 billion for NHIF, and of these, 2.5 billion is for Linda Mama. If we receive this 5.5 billion within this week, then payment of claims for Linda Mama will start from next week. On the second issue, explain measures taken to ensure the continued operation and access to free maternity services under Linda Mama initiative, particularly in the light of Social Health Insurance Fund yet to be fully implemented. Honorable Speaker and honorable members, the government enacted the Social Health Insurance Act 2023 to provide a framework for improved health outcomes and financial protection in line with the right to health and universal health coverage. The Act establishes the Social Health Authority that will manage the Primary Health Care Fund, Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. Maternity services have been provided as part of the scope of the benefits package to be accessed under Social Health Authority. To access the benefits package under Social Health Authority, all Kenyans are expected to register with Social Health Authority in line with the Social Health Insurance General Regulations of 2024. Benefits under SHA will start to be accessed from the 1st of July 2024. However, NHIF continues to operate, so there is no gap, and we are ensuring that there is a seamless transition. The government also recognizes that we have low-income households who may not be able to raise the minimum amount of 300 shillings for Social Health Authority. The government will, in this regard, pay premiums for these households who may include pregnant women in order to enable them access maternity services. This is in line with Section 27, Part 2C of the Act, which provides that in the case of households in need of financial assistance, as determined by the government at a rate appropriated by Parliament and county assemblies for that purpose, as prescribed under this Act. Part 3, provide details on how the Social Health Insurance Fund will facilitate comprehensive access to productive health care for women. Honorable Speaker and honorable members, the Social Health Authority will facilitate comprehensive access to reproductive health care for women by providing explicit listed benefits accessible at Level 2 and Level 3 health facilities and at no cost to the member through the Primary Health Care Fund, which is fully financed by the government. A list of the benefits package of maternity services to be accessed through Primary Health Care Fund and Social Health Authority has been annexed to this presentation, and we shall leave it behind. Some of the benefits include access to family planning, antenatal care, pre- and post-delivery visits, deliveries, that is normal delivery and cesarean sections, complications related to deliveries. Just before and after the launch of the benefits package, the authority will invest in massive communication campaigns to inform mothers and all Kenyans of their entitlement to these benefits. Honorable Speaker and honorable members, I am aware that some members are thinking that Linda Mama has been scrapped and therefore there is no benefit for women. Honorable Speaker and honorable members, I wish to confirm that myself, I am a mother of 2, and indeed, I am aspiring to be a mother of 5. Therefore, the existence of Linda Mama will therefore ensure that all benefits under Linda Mama are ring-fenced, not just for myself as an aspiring mother, but for all the women of this country. Honorable Speaker and honorable members, I submit. Thank you.
Mshomba. Let the questioner.
Thank you, Mr.
have the
Speaker.
first bite.
I appreciate that we have gotten some response from the Cabinet Secretary concerning Linda Mama, and indeed congratulate her for aspiring to be a mother of 5 in the near future, and wish you well. However, Mr. Speaker, yesterday morning I visited a facility, a private facility in Kiambu County, after a few women alerted me that they have been apprehended in hospital because they were not able to pay for their medical care after delivery, and they held with them an NHIF card, which was not admissible. I had to plead with the hospital to allow the mothers to leave the facility and gave my personal guarantee that should they not be able to take care of their bills, I will do so as a mother. And therefore, when the minister tells us that she acknowledged that there has been a delay of remittance of some fund from Exchequer to some private facilities, she's right. And she says she's hopeful that that remittance is going to be done as soon as possible. She says this week.
Ask your
So the question is, what remedy should you give to such a mother who called me yesterday? What is she supposed to do when she goes to a hospital to deliver, noting that babies don't wait for next week, for exchequer, to pay for the money? What remedy does the minister provide for that mother of Kenya who is now in hospital to deliver, has a card, and it is not admissible in private facility? Thank you.
The first joyrider, Irene Mayaka.
Thank you, Honorable Speaker, for the opportunity. Honorable Speaker, I just want to inquire from the Minister. I recall on the 8th of June in 2022, the then Deputy President, William Ruto, gave a pledge that under his administration, new mothers will get 3 months' supply of diapers upon delivery. From what I know in Nyamira County, I have never seen that happen. So I just want to know, is this a pledge that drank water? Thank you.
Yes, Milemba.
Thank you, Honorable Speaker. Let me begin by thanking the Minister for having gotten two ready for this session. I've been following very keenly. Congratulations with the team. Number one, as a question, Honorable Speaker, the Minister should know that we have a lot of touch with the ground. Is she aware that the NHIF in particular, riding on the question by Honorable Muchomba, has not paid hospitals since July 2023, and I wanted to speak on that. And that today, some hospitals are actually turning away NHIF cards, especially for our teachers. And I've been given examples here already, like some of the hospitals, but I wouldn't want to mention them because of the privacy policy. Please, that's my question.
Isula.
Thank you, Mr. Speaker. And also, let me take this opportunity to congratulate Madam CS, because listening to her, she seems to have done her homework and also knows her stuff in the quality of answers that she has given to us to the questions. I just want to ask the CS, in terms of ensuring there is a smooth transition, because, you know, Kenyans are talking about they don't have a problem with the taxes or deductions being made, but they want to get the services of the monies that are being deducted or the taxes that they are paying. What measures have you put in place as a ministry and also as a fund to ensure that there are no lapses like the one we are seeing, especially with our mothers, when they go to the hospital? Secondly, the last question is that there's been this monster called cartels. You know that NHIF, why we're moving from NHIF to SHIF, is because we want to deal with the cartels and not face the challenges that NHIF is facing now. So I'd just like to hear briefly what measures have been put in place by the ministry to ensure that we don't get any excuses in what Kenyans expect to get, and what is this monster called cartels.
Thank you, Mr. Speaker, and thank you, CS. And I also want to congratulate her for the strong show she has shown this evening on the questions that were asked and the quality of answers she has given. Mr. Speaker, I wanted to ask the Cabinet Secretary. There's an issue of cancer centers in this country, and cancer is an issue that is of national importance. We have three. Yes, we have 3 cancer centers in this region, Mr. Speaker, that are manned by the county government. That is Mombasa, Garissa, and Nakuru. They are all failing to offer services. And I was asking whether the minister can consider that those centers be referred back to the national government for service delivery. And considering that NHIF today is not able to accept the cards that patients are taking again to those same facilities. Those facilities are actually dying, and I'm requesting the minister to consider that these facilities are reverted back to the national government for management purposes. Thank you.
Last, Karoli Omondi. Modoni, you also have a question? Karoli, quick one.
Thank you very much, Right Honorable Speaker. I just wanted to know from the Honorable Minister whether her ministry has a plan to do a review
of the impact of devolving medical services in terms of whether they've improved services, whether they've improved the terms and conditions of service for doctors, whether the element of insurance is working. Because my experience is, around the world, the countries that have the best medical systems have unitary systems, like NHS in England. Those that don't have, like in the US, medical services are in very poor, sorry state. Or if you go to the Scandinavian, where there's collectivization of insurance, everybody collects tax, there's one unitary medical supply system. So I'm just wondering whether there's a plan to do an audit, a holistic audit together with the county governments on the impact of devolving medical services. Thank you very much.
Mudhoni?
Thank you, Honorable Speaker. Indeed, Honorable Speaker, I want to round the CS Health. She's well prepared, and I'm sure she has tackled a laughter of issues that members had. Honorable Speaker, I just have two concerns. One, as we shift from NHIF going to the new chief, what measures has the ministry put in place to ensure that when you go to an health facility, the services that you get there are seamless? Honorable Speaker, I'm asking this in relation to where many a times you go to a health facility and you are told to wait for what they call pre-authorization. Honorable Speaker, sometimes it's an emergency and you see family members helpless and not knowing what to do because that pre-authorization takes ages. Number two, Honorable Speaker, we have various entities like the teachers who would contribute to this scheme and every other worker. Honorable Speaker, what guarantee is there that when they attend any facility that is next to where they require services, they will be attended to instead of being told just fill 2 hospitals where you'll be attending, and you are not static, and sickness will not wait for you to go to the nearest station to your home. Thank you, Honorable Speaker, but congratulations to the CS Health.
Farah Maalim. Give Farah the mic. There's one next to you.
Oh, yes, yes. I want to join my other colleagues in congratulating the Minister for making a serious effort. I know this is the beginning, and there's going to be a lot of conversation on this issue. But I want to ask the Minister whether the Ministry has ever considered something akin to what they call in the UK National Health Services. We have a Teacher Service Commission in the country. We need something that encompasses the entire health, that looks at the quality of training, that looks at the training of doctors, nurses, physiotherapists, everybody, employment, and all that in a holistic manner. Because we have a situation, Mr. Speaker, in which a consultant surgeon who had a straight A in his Form 4 and went through university and did 16 years of education will be interviewed by an MCA who has got a D+. Mr. Speaker, sometimes we need to give the weight that we need to give to this very critical sector, because these are the people we are going to entrust with our lives. We need to look at this thing in a holistic manner, whether it's going to be looking at the Constitution also, and look at how we can have a body that runs this thing, a body that essentially is going to be involved in the employment, in the benefits, in the etiquettes, in all those things, the integrity of that, what they call the Hippocratic, they call it Hippocratic oath that the doctors take. And we can have these things similar to the way we have it in the Teacher Service Commission right now, and the way they have it in the UK in the National Health Services, and a number of European countries. We don't have to reinvent the wheel again. Do have that. I do understand that our Constitution of 2010, when both me and you were in this parliament, there are a lot of things that needs to be changed. Having experienced this now for 10 years, can we look at it in that holistic manner and the minister give us an undertaking? Thank you, Mr. Speaker. An undertaking on that possibility itself. Thank you.
Beatrice, I want to close here.
Thank you, Speaker. Yes, I'll be very brief. Mr. Speaker, in terms of, first of all, to appreciate Waziri so much for clarity in the many issues she has answered. But then, this issue of NHIF with missionary hospitals, the private hospitals, we need to look at it, because I will tell you, Waziri, there's this mama right now at Mary Immaculate here on Gatanga Road. When she went to Mbagathi, she was sent back there for CS. She has an NHIF card. She can't use it. She has been detained in hospital as much as she has paid her bills. So it is important to have a conversation together with the private hospitals to see how we unlock this issue of NHIF with them.
Thank you. Minister, can you respond quickly to those?
Thank you, Honorable Speaker and Honorable Members. I appreciate the question. The first question from Honorable Wamshomba on the remedy. That is the instant remedy as we speak. Honorable Speaker and Honorable Members, the crisis that we are in is affecting the health sector. But I also want to confirm, Honorable Speaker and Honorable Members, that level 2 facilities, that is the dispensaries, that are manned by the nursing officers are functional. Level 3 facilities, the health centers, are equally functional. Where this crisis has hit us most is on level 4, level 5, and level 6, where the specialized services are needed. Honorable Speaker and Honorable Members, we have put in place mechanism to ensure that emergency care that is required is given in all the national referral hospitals. But with the meetings that we have had with governors, we have asked them to also put in place measures to ensure that should a mother need emergency care or any Kenyan need emergency care, they should be attended to. Administrative actions have been taken, including employing some doctors on short-term contracts, including employing some locums to be able to fill the gap. So, as a ministry, we have put in our best effort to ensure that the services are being provided, but we acknowledge the crisis that is at hand. And that is why, Honorable Speaker and Honorable Members, I would like to plead to the doctors of this country that their life is most important. With the monies, negotiations can always be done. If today you don't get it and circumstances improve tomorrow, a doctor will be able to be paid. But if we lose a life, we will not be able to recover that life. So I would like to speak to the doctors, Honorable Speaker and Honorable Members, that they come back and comply with the court order and suspend the strike and give these talks a chance so that we get amicable solutions. On the question raised by Honorable Mayaka on the diapers for mothers, Honorable Speaker and Honorable Members, I would like to confirm that the Kenya Kwanza government had a huge manifesto and there is a plan on delivering of the manifesto. Quite a number of the items that were listed in the manifesto have been achieved. Implementation of a manifesto is progressive. And I want to say, as a ministry, we are seized of that matter. And at the opportune time, when resources are allocated, and thankfully I'm speaking in the House that oversees resource allocation, once we get the resources for diapers, we shall be able to give them to mothers. But I want to confirm that this Kenya Kwanza government is committed to implementing its manifesto. The question raised by Honorable Malemba on the transition from NHIF to Social Health Authority, yes, there's a lot of anxiety across the country. Many people, and even facilities, are thinking that maybe their claims will not be paid. But I want to confirm to the nation that we have a transitional committee whose terms and of references is one, to ascertain the claims, to reconcile the claims, so that the assets and liabilities of NHIF will be moved to Social Health Authority. Any claim that will not have been paid by the time we transit on the 1st of July will be taken over by the Social Health Authority. So I want to appeal to facilities, those who are denying Kenyan services, that your claims will be verified, reconciled, and paid once resources are available. And I have just confirmed, Honorable Speaker and members, that this week we have received confirmation from Treasury of release of 5.5 billion. That is going to go towards payment of claims. On the question raised by Honorable Naisula regarding the services, what are we going to do to ensure that services are ring-fenced under the Social Health Authority? Honorable Speaker and honorable members, the Social Health Authority is 90% digitized. And the reason why it is 90% digitized is to ensure that we remove the risks that existed in the National Health Insurance Fund that enabled or was able to oversee leakage of revenues and leakage of resources from National Health Insurance Fund. We have a digitized system that is able to ring fence, and equally in the new laws, we now have free primary health care under level 1, 2, and 3. That is going to be provided without a Kenyan having to pay anything. But once they are referred to level 4 and other level 5 and 6, then their Social Health Insurance Act fund kicks in to take care of them. The issue of cartels, Honorable Speaker and honorable members, is an issue of the system and governance. And that we are working on it. We have been able to demonstrate through KEMSA on what we have been able to do. Equally through the National Health Insurance Fund, the governance issue, we have taken care of it. Under the Social Health Authority Act, the board was carefully selected. We are going to do a careful selection of all the people who will work in that institution. But we should get the comfort of having a digitized system that is free from any manipulation to ensure that then systems run as envisaged. On the question of the cancer centers, and I want to acknowledge that indeed the national government gave these cancer centers. And like especially in the case of Garissa County, it is the county that came asking the ministry to ensure they hand over quickly the cancer center. And that was done. But we have received reports, including the Committee of Health which visited that, and we have a report at the Ministry of Health. And we are in discussion of how then we support those regional cancer centers. Because we cannot arbitrarily say that now we bring them back to the national government, but we can get into a framework of management, because management of those equipment is capital intensive, and therefore we want to get into an agreement with the county governments on how we can jointly do that. On the issue of whether we have done a survey or not, we have the Kenya Demographic Survey that is done after every 5 years. And Honorable Speaker and members, I want to confirm that under the devolved system of government, we have positive outcomes on health. For example, the maternal mortality rate has reduced. The infant mortality rate has reduced. And there is clear indication that even the distances that were being traveled by Kenyans to access services have reduced based on the health facilities that have been put in place by the county governments. Having said that, I think there's an opportunity then for us to have a national conversation on all these areas, especially the other functions that are being done by the county government, and see then how best we remedy if there are gaps in implementation. On the issue raised by Honorable Modoni, as a ministry, we did gazette the transitional committee, and we expect there to be a seamless transition. However, we know that there could be challenges here and there, and the biggest risk we have identified as a ministry is the unpaid claims. So we are in discussion with National Treasury to ensure that these claims are paid, so that then they do not impede the transition from NHIF to Social Health Authority. But also want to confirm that under Social Health Authority, there is no pre-authorization that is needed for emergency care. If you need emergency care, there is no pre-authorization that should be provided. Under the existing National Health Insurance Fund, there was selection of facilities. And that is one of the items that we dispensed with in the Social Health Authority. There is no more selection of facilities by Kenyans. If you are registered to get services wherever and whenever you are. And we are going ahead with digitization to integrate all services and ensure that there is movement and portability of patient data, that should a patient want to move from one facility to the other, they do not have to carry exercise books, they do not have to remember anything, they'll find their data available at their next level of service. And equally, the ideal situation is that patients should be able to manage their information on their mobile phones. And that is an ideal situation that we hope to move to into the future. The question from Honorable Fari, Health Services Commission. Honorable Speaker and Honorable Members, I think this has been a question generally in the public, but the creation of Health Services Commission is beyond the mandate of the Ministry of Health. But I want to believe that during this time, during this crisis, when we have all of nation approach, we are going to listen to all suggestions, and if indeed it's determined that Health Services Commission is the cure of the perennial issues that we have, I believe the responsible arms of government will then be able to start a conversation. But having said that, the Kenya Kwanza government operationalized the Kenya Health Human Resource Advisory Council. It is meant to be able to manage the human resource for health, be able even to manage the distribution of different cadres across the counties. And all we need is resources to finance that. On the question of Honorable Beatrice Elachi, I have already confirmed that we have an issue with the claims. But I want to believe that once we receive these resources that we are expecting this week, from next week we start payment. But Honorable Speaker, also to confirm that payment of claims is a continuous exercise. Last year only, NHIF paid out a total of 36 billion in terms of claims. So this is a continuous exercise that will continue, but where we have specific cases as a ministry, we are ready and we shall be looking into the specific issues that have been raised so that we handle them. Honorable Speaker and honorable members, I would like to confirm that the Kenya Kwanza government has a plan on delivering UHC. And as a ministry, we have clarity on what we need to do to deliver universal health coverage. We have worked on the commodities through the reforms at KEMSA. We have worked on financing through the laws that we have put in place. And we had already started working on human resource for health. Unfortunately, this crisis came in, but I want to believe that it is an opportunity for the Ministry of Health to be able to resolve the HRH issues for once and for all. Honorable Speaker and honorable members, I submit. Thank you.
Thank you, honorable members. Thank you, Minister. That is the end of question time. You and your team are released. Next order.
Order number 9, the National Land Commission Amendment Bill, National Assembly Bill number 43 of 2023, second reading, resumption of debate.
I'm told Honorable Zamzam was on the floor. Can you wipe the screen so that I see who the new interests are? Beatrice Elachi, you want to speak to this? Carolo Mondi, okay. We'll start with Beatrice Elachi. Carolo, you better log in. Don't see you on the screen.
Thank you, Mr. Speaker. Mr. Speaker, I rise to support this amendment bill by Honorable Owen Bayer. And Mr. Speaker, in the amendments, what the member is requesting is to see how, because of the crisis that is in the ministry or in the commission right now, that the 5 years has lapsed and now they need more 5 years to come in so that they are able to continue with their mandate. But Mr. Speaker, when you look at that, which is a good idea, yes, but also it means we are just going back to the old where we used to have the open end of where at many years the same injustices we've been speaking in the Ministry of Land and all that will just come back. So the best that we can do, as much as we are supporting, is to give back the 5 years, we review what is there, and they proceed the way they have been working. Because if we just open, it means anyone also can just come in. The ministry will start having, this
it will become an overlapping issue with the ministry, with the commission. We won't even know now where to move. So as much as I support it, I want us to be very clear that we will go back on what the Constitution intended and review and just give the commission the 5 years they need to continue with their work. The other thing, Mr. Speaker, is that while we are doing all this, and while even we are talking about the issues of land, the injustices, the biggest injustices we are finding ourselves, and I have kept on crying, is the schools that we have in Nairobi, where the titles, when you look at them, you are asking yourself, how did the title of a school find itself with estates inside, with people, they are the ones who man and hold all the huge systems that we have of Safaricom. So you find Safaricom just paying other people, not even the schools itself. And when you go for the titles, like now, I've just seen some recommendation from the Ministry of Land that says the title in 2017 of Lavington Primary School, Mr. Speaker, was, there was one person, Kemson, who were trying to fight to say part of it is their title. But then it was revoked in 2017. Now my question is, if it was revoked in 2017, why are we back again in conflict with the same team? So for me, even as we look at all this, and it's like we wait until the end is when we come rushing into Parliament to look at all these things, and yet it is in the Constitution. We knew very well in 5 years they will have a crisis. But we have waited until it is lapsed is when we are coming, Mr. Speaker. And so in this time, you can imagine how many things are now moving around and being done in the wrong way. So for me, Mr. Speaker, what we need to ask ourselves in the amendments that we have of Oyon Baya is that, one, let us relook at the mandates. Let us stop this conflict we have created where the ministry is becoming more powerful even than the Land Commission. And then you find yourself again back to the same challenges we used to face. Somebody else, the file is hidden. I have been looking for this file of Lavington Primary. We have looked for the last 2 years. We've walked a journey in the ministry. And I just want to thank CS Alice Wahome. When she has come is when now things have started also moving out very fast. So for me, even as I conclude, Mr. Speaker, this issue of land, the land injustices, private land, public land, the big crisis we face in Nairobi is the public land that people have just taken, Mr. Speaker, until you can't even know which is public land, which is private land, how is a title in a zigzag manner, in a W manner, and you're wondering why is townhouses in the school, and yet you are being told that is how the title is. As we look at that amendment, Mr. Speaker, we want also this House to come up with a clear resolution of all our schools and to go back and look at the map of these schools in a proper way, the way the deed was, and tell ourselves, how did we end up losing so much land that was meant, a primary school in Nairobi was meant to have a secondary school, Mr. Speaker. Today we can't. And even if we have, we are squeezing them because people have taken this land. And when you go for the title itself, you find yourself in a crisis with Nairobi.
What's your point of order, Honorable KJ?
Mr. Speaker, as you would appreciate, the last thing I would want to do is to interrupt my very good neighbor, the Honorable Beatrice Elachi, especially when she's making such an important point regarding school land in Nairobi. And Mr. Speaker, that would point us to the weighty nature of the matter that is on the floor before us, knowing how critical land issues are. And it is on that rostrum, Mr. Speaker, that I stand on Standing Order number 35, calling upon the chair, because I would imagine that the chair is blind to the situation, calling the situation of the House to the attention of the Speaker to see what our quorum looks like and to make a decision, Mr. Speaker, pertaining to the quorum issue as is provided for in Standing Order number 35. So, Honorable Speaker, I am very apologetic to the Honorable Beatrice Elachi, and I know she has the right to continue and complete her contribution, but I wanted to call the attention of the chair to the situation of the quorum in the House. Thank you very much, Mr. Speaker.
Indeed, yes, it's abundantly clear that we not only don't have a quorum, but we do have, I don't know how many people, is it 5 or 6 people in there? Please, can you ring the quorum bell, please? Ring the quorum bell. And ring it for 10 minutes. Honorable members, there being no quorum, the time being 6:41 p.m., this House stands adjourned until Thursday, the 18th of April 2024 at 2:30 p.m.